Sandra with RejuvenationMD, and today we're doing some PDO threads for some lift in the lower face and the neck area. When we're looking at lifting someone's neck, really we have to lift the tissue above it first to get the really nice results that we're looking for. So I've already marked the patient out, and then she's numbed in the areas where I'm going to go in and place the threads, and then I'll sit her up and take a look and see where we are with the treatment. So the threads are mounted on a cannula, and the cannula has to go in through an insertion point. So this is what I was just doing, was just creating that insertion point first.
Can't even feel anything.
Good. So prior to placing these, we had talked about some people need laughing gas or Pronox just to, you know, have low anxiety through the procedure. So was just checking in to make sure that she felt like she needed it or not. Well, there's different types of PDO threads. So these threads are barbed 360 degrees, and they're helical, and they're bidirectional, so it goes all the way around the thread. So these are definitely a thread that we like to use in an area where we want some lift. There are smooth threads that are good for like the fine lines in this area. You can insert a bunch of them, and that helps build collagen and plumps those areas out. So it kind of depends on the area you're treating. You can insert them anywhere that you want some lift and where you want to build some collagen. Okay. You can see how the threads just lift the tissue right up in the area where they're inserted. Some people, if their skin is too thin, they're not necessarily a good candidate because you can see the threads sometimes. So we like to carefully screen people to make sure that you're not going to see the threads. If you do see the threads, they get reabsorbed over, 4 to 6 months. So it isn't something that you would live with permanently, but you can, if that were to happen, it does disappear over time. So we usually have people sleep in a manner that's going to keep them up off of their face. So in a recliner or on your back, especially if you're like a heavy side sleeper or sleep in your arm, we really want to avoid that. And just, primarily for your comfort, because these are barbed, and it's a helical 360 degree barb that is in the thread. There's less concern about them becoming dislodged or moving. There's another type of thread that used to be used that could have more of an issue like that, but we don't use those threads here, so that's not something that you have to worry about. But especially for comfort, no soaking in any dirty water. Not that many people soak their face in dirty water, but pond, river, hot tub, we don't want you soaking anything like that until these areas of entry are closed and healed over. It's not too, you can be uncomfortable. So if you feel like you need to take some Tylenol or ibuprofen, as long as you don't have any contraindications for either of those, you can certainly do that. It's pretty minimal. The aftercare is not too bad. You're doing great.
And sleeping upright for how long?
So I usually just say, let the discomfort be your guide. So if you're feeling uncomfortable and you're, mash your face when you sleep, then you're going to want to sleep upright for, 3 to 5 days. If you sleep on your back, then it's not going to be an issue for you. Okay, so I'm going to go ahead and sit her up and see how things are looking. And